Hi, my name is Adebayo Christopher Adedonyi. I'm an anesthetic technician and I also do supply medical consumables to all Nigeria hospitals. Today we are going to be discussing one of the important medical devices being used in the world of anesthesia and which belong to the family of breathing filters. Though this family is divided into two, which are the bacterial filters and the HME filters. But I will not talk about the bacterial filter because I will do another video that relate to that maybe soonest. But my concern today is the HME filter. And now, what is HME filter? HME filter is heat and moisture exchangers. Now, what is the function? The function is found in the name, meaning in every of our inspire air or inspire medical gases, the HME filter help to warm, moisturize, and to filter the inspired oxygen or inspired medical gases. Remember that our respiratory system is divided into two tracts, which are the upper respiratory tract and the lower respiratory tract. The upper respiratory tract, which is made up of the mouth, the nose, the pharynx, the larynx, the vocal cord, and the sinuses, they does a special function in us which involve the warming, the moisturization, and the filtration of every of our inspired air. So now the patient that is under anesthesia whose upper respiratory system has been bypassed, what now perform this function of heat, moisturize, and filtration? It is this guy. Because a patient that is under general anesthesia, this medical device, which we call the endotracheal tube, has bypassed the function of the upper respiratory system because it goes directly to the lower respiratory tract of every human being during general anesthesia. But with the function of this guy, so the use of this guy or the attachment of this device to the endotracheal tube automatically take over the function of the upper respiratory tract. Because when this device is not being used, it is possible for a patient to be taking in dry medical gases, which is very dangerous. And it is also possible for the patient to acquire what we call VAP disease or VAP infections, which we call the ventilator associated pneumonia, which we also call the nosocomial infections. You know, nosocomial infection is the type of infections that is being acquired in the hospital environment. What does it mean? It means a patient can come to the hospital without having any diseases or any infections, and while going back, it is possible when the right procedure is not being followed, it is 100% possible for that kind of patient to go back to his or her houses with an acquired pneumonia, which we also call the nosocomial infections. Now I'm talking about the general anesthesia, and that is why it is very important for the patient that is undergoing or that is undergoing general anesthesia to have this thing being used. So ideally, an anesthetic will not go into medical procedure in the operating theater without looking for this medical device. And do you know the good news? The good news is that I have these medical devices in bulk. Meaning anywhere you are in Nigeria, I do supply this medical device to all Nigeria hospitals. So please don't waste time in placing your order.